Let's discuss zoonotic diseases. Zoonotic diseases are diseases that are transmitted from vertebrate animals to human beings. We will discuss this session according to following learning objectives. We will discuss epidemiology of zoonotic diseases of common public health importance, like rabies, brucellosis, tetanus, scabies, and plague. We will discuss their epidemiology. Then we will discuss their clinical features, and then we will discuss their control and prevention, how these diseases can be controlled, how these diseases can be treated, how these diseases can be prevented. And then we will discuss the summary. So let's start. Zoonosis is a Greek word. It's a combination of two Greek words, zoon, animal, and ozoon means disease. They are first used by Rodolphe Virchow, who defined that these are communicable diseases. Then these diseases are infections. They are transmitted between vertebrate animals and human beings. World Health Organization called them communicable diseases in 1959. He is the scientist who said that these are communicable diseases. Let's start with rabies. Rabies is common in rural areas of developing world, especially Pakistan and India. It is due to dog bite. There are stray dogs, there are rabid dogs who bite a person and transfer rabies to human beings. It is very fatal disease. It can cause death. So it is fatal disease of central nervous system. Virus invades CNS. It's a viral disease. In India, it causes 20,000 deaths per annum. In Pakistan, it is also causing deaths, especially in rural areas where dogs are common. Most dogs are rabid dogs, are stray dogs. It is present throughout the country. And incubation period varies from 3 to 8 weeks. So, what are various clinical features or clinical presentation? Clinical features are pain and tingling at site of bite. There is severe pain. A person becomes intolerant to noise, light. Then there is hydrophobia. You must remember hydrophobia. It is pathognomic sign of rabies. Their reflexes are increased. There is spasm. There is perspiration. There is lacrimation, salivation. Cause virus transfer from saliva of infected animal to human being when it bites. Prognosis is very poor if it is treated within 6 days. Prognosis may be better, but if it is treated after 6 days of post exposure, prognosis is fatal. It is poor. It can cause death. Although there is vaccine available, it's a preventable disease. And for rabies, you have to give vaccines plus immunoglobulins. Both are used for management of rabies. So, when vaccine can be given? Vaccine can be given at 0 days, 3 days, 7 days, 14 days, and at 21 days. These are days of rabies vaccine. You must remember this. Plus, you have to give immunoglobulin. Both are given. Now, the question arises, which people should be vaccinated? Those who are at high risk. Everyone who is at high risk should be vaccinated. Who are at high risk? Farmers, person working in zoos, living in near jungles, are in highly endemic areas. All the vulnerable people should be vaccinated. There is prophylaxis vaccination, and it must be managed within 6 days. We can manage wound. Wound should be cleaned. Then we can give vaccine. 5 doses of vaccine can be given. It's a common university question. When rabies vaccine is given, it is given at 0 days, 3 days, 7 days, 14 days, and 21 days. Plus, it's a common MCQ that immunoglobulins should also be given with rabies vaccine to vulnerable people or infected people. Wound should be cleaned. Brucellosis, it spreads to sheep, predominantly sheep and cows. Brucellosis is a bacterial disease. It is also called Malta fever, Mediterranean fever, and most human infections are caused by Brucella. It is highly infectious. It spreads after ingestion of milk or after eating meat of these animals. After eating meat or after drinking milk from infected animals, brucellosis spreads. So we need to boil the milk. We need to properly cook the food. What are various clinical features? prolonged bacteremia. There may be fever, chills, muscular pains, body pains. There are sweats. There is anorexia. There is constipation, nervous irritability. Bacteria spreads to nervous system. It causes fever, chills, anorexia, abdominal pain, nausea. There is constipation. What is chronic brucellosis? There is sweating, joint pains. They are common. Pyrexia may be absent in chronic brucellosis, but joint pain are common in chronic brucellosis. Blood culture should be done immediately. We can do PCR as it is a bacterial infection, so antibiotics can treat it. We can give streptomycin, we can give tetracycline, sulfonamides. We can prevent it by boiling milk, by properly cooking meat. All the animals should be vaccinated against brucellosis. Vaccination is important. We need to vaccinate. Then what is plague? In previous years, in previous centuries, plague caused lot of deaths. Mortality was higher because treatment was not available. There were pandemics of plagues. Plague, plague is a deadly disease that is caused by Yersinia pestis. Nowadays, treatment is available, but in 8th century, 10th century, 19th century, there was no treatment and a lot of people died. It transmits through droplet. There can be direct physical contact. It's a vector-borne disease. It is carried by insects and animals. But most common are rice, rats. Rats and fleas transfer plague. So you must remember the vectors. Rats and fleas are vectors of plague. It spreads through droplet infection. What are the common clinical features of plague? There is fever. There are chills. There is severe weakness and headache. There is tenderness of lymph nodes, inguinal lymph nodes, and femoral lymph nodes. There is inflammation. There is swelling. And symptoms usually appears from 2 to 8 days after exposure. Plague may lead to complication, disseminated intravascular coagulation. It can cause meningitis. And then it can cause multi-organ failure, which is fatal, which can cause death. These are the symptoms of plague. It is preventable disease. It's a treatable disease nowadays. Nowadays, it has become less fatal. We can diagnose plague by rapid bedside test in remote areas. This test is performed to identify, to diagnose plague. Then it is treated. How it is treated? Gentacin, streptomycin. These antibiotics, they have improved the prognosis. They have reduced the mortality due to plague. Now it is less fatal disease. Chloramphenicol can also be given. So you can remember gentamicin, streptomycin, and chloramphenicol. Scabies, a highly contagious disease, common in school children, common people who are living in our crowded places, in barracks, people who are going to perform their religious duties. It is a common disease. Scabies can cause itching of skin. Causative agent. It is asked commonly. Sarcoptes scabii. It's highly contagious, spreads quickly through physical contacts. In family, in children, in school, children play together. They transfer scabies from one to another. Children sit close in classes or in nursing homes. This disease is common. This disease spreads rapidly there. What are the causes? Close physical contact. People do share clothes. They do share bedding. So infected person can transfer mites, can spread mites by sharing clothes, by sharing beds. Cats and mice are also affected. What are common sites of itching? Scalp, most common site. Then face, neck, palms, soles of feet. These are the commonest sites. Most common symptom is itching. It usually becomes worse at night. Blisters are found on skin. We can diagnose scabies clinically. Doctor examines skin. He can look at signs and symptoms. He locates burrows, he can locate eggs, and microscopic examinations. So you can remember clinical examination and microscopic examination. These are tests to identify scabies. What is treatment? It's a treatable disease. Several medications, several creams, several lotions are available. But remember that doctor may recommend treatment to whole family or to all family members or to close contacts. They should also be treated. Best way to control, to manage scabies is to treat all the household contacts, all the family members. Which medication? Permethrin 5%. This is the commonly used drugs. Linden. This medication is also used. It is available in the form of cream and lotion. Crotamyton. This is also used medication. This medication can also be applied. And in immunocompromised people, ivermectin can be given. Doctors can suggest ivermectin, especially in immunocompromised people who have altered immune system. This drug can be given. How can we prevent scabies? Hygiene is very important in prevention of scabies. We need to clean all the clothes and linen. We need to starve the mites. We can use coal and soak in. These are home remedies. We can apply soothing lotion. Antihistamine can also be suggested. They can also be given in case of severe itching. So, lifestyle modification, personal hygiene, personal protective measures are essential. We need to clean all the clothes. Usually, medication is used for 3 days. We can apply the lotion at night time, take bath in the morning, and change the clothes, change the bed sheet, because it spreads to fomites. So, we need to clean the fomites. These are itching. What is tetanus? Tetanus is a bacterial infection, bacterial disease. It can be fatal. What is causative agent of tetanus? Clostridium tetani is causative agent of tetanus. It is anaerobic, motile, gram-positive bacilli. It is found in worldwide. It is found in soil. You should remember soil. And it is found in environment, human feces, animal feces. Soil contaminated disease. Tetanus is international health problem. They spread through spores. It almost occurs in every person. Person who are not immunized can get tetanus. It occurs worldwide in hot, damp climates in developing countries. It is more prevalent due to urbanization or industrial development. And most lethal or most fatal form is tetanus neonatum. Why? Cause of less or lack of maternal child health care services, lack of septic measures, lack of neat and clean delivery. Tetanus neonatum can be fatal, it can cause death in neonates. What are host factors? It is common at the age of 5 to 40 years. Newborns and female are highly vulnerable. There is higher incidence in males. Agriculture workers, they are at risk. People who are living in rural area, they are at risk. Immunity, herd immunity does not protect. There is no herd immunity. There are environmental factors. There are social factors, unhygienic custom habits, unhygienic delivery. As people are not much educated in developing world, especially in Pakistan and India in rural areas. They don't go to hospitals for delivery. They don't go to trained healthcare workers for delivery. There are traditional birth attendants who have lesser knowledge regarding septic measures. They can spread tetanus. They can cause tetanus neonatum. What is route of entry? Injuries, bites, fractures, burns, gangrene. These are the route of entries. Also, drug abuse. Spores are very stable, but they can be killed by heating, by boiling. They can be destroyed. If boiled for 15 minutes, they can be destroyed within 15 to 20 minutes. We can do sterilization. Ethylene oxide is used. Iodine can also be used. So we need to kill the spores in order to control tetanus. What are clinical features? Incubation period range from 3 to 21 days. When symptom starts, there is spasm at the site of entry. Remember the thing. If injury site is far from nervous system, incubation period will be longer. If it is closer to nervous system, incubation period is lesser. The shorter the incubation period, there is greater chances of death. There is triad of muscular rigidity. There are spasm. There is abdominal dysfunction. There is stiffness. Christmas. Lockjaw is common. And spasm usually continues for weeks. Muscular rigidity. There is descending paralysis. Remember this thing. There is descending rigidity, descending paralysis. Jaw and facial muscles are paralyzed. And then it spreads to lower limbs. And it can spare hand and feet. And not present there. There is rhizus sardonicus. It produces rhizus sardonicus, contraction of muscles, trismus, opisthotonus, spasm of neck. This is common. There is poor cough, inability to swallow, gastric stasis. There is dysfunction, dysphagia. There are reflex spasm, laryngeal spasm are common in tetanus. Other symptoms may be fever, irritability, uncontrolled urination. Duration of illness is longer. It can take weeks. It can take up to 6 weeks. You have to remember sequence of events. First there is lockjaw, then there is stiffness of neck, then there is difficulty in swallowing, then muscles become rigid, and then there are spasm, dizzytrismus, lockjaw, main symptom, then rhizus sardonicus, then opisthotonus. So you can remember trismus, rhizus sardonicus, opisthotonus, spasm of muscles. They are common in tetanus. There is rigidity. There is descending paralysis. We can grade tetanus. Tetanus can be from mild to severe. In mild tetanus, there is moderate trismus. In moderate, grade 2, there is moderate trismus. Then there is severe trismus, severe rigidity, severe spasm, and can autonomic, when it causes autonomic dysfunction, it is very severe disease, which is fatal. Grade 3 and grade 4 cause fatal disease. What is maternal tetanus? Tetanus that occurs during pregnancy or after 6 weeks after termination of pregnancy is maternal tetanus. It includes postpartum, puerperal tetanus. Postpartum tetanus is common if there are septic techniques are not used during delivery. People often don't use septic techniques, especially living in remote areas. Tetanus during pregnancy is fatal because it transmits through vertical transmission to newborns. So vertical transmission is also mode of transmission in tetanus. All the pregnant females should be immunized against tetanus as soon as possible. What is tetanus neonatal? It is fatal if it is untreated. Mothers are not immunized. Tetanus transfers from placenta to newborn, especially during first weeks. It causes poor feeding, rigidity, spasm. So it is a preventable disease if 2 tetanus doses are given to females who are pregnant, and we should have neat and clean delivery practice. Delivery should be done by trained staff. Septic measures should be used. This is tetanus neonatal. There are rigidity, there is spasm. How it is diagnosed? No blood tests are available. Usually, there is leukocytosis. So you can remember leukocytosis. CSF findings are also normal. So it is a clinical diagnosis. We need to diagnose tetanus clinically. We can take history, then we can perform clinical examination, then treat it as a case of tetanus. What are principles of treatment? Neutralization. Tetanus spread from toxins, so antitoxins can be given, immunoglobulins can be given. We should perform wound debridement. Antibiotics can be given. We need to control the spasm, anticonvulsants, sedatives, muscle relaxant. They can be given to control the spasm. Barbiturates, magnesium sulfate can be given. There should be sportive treatment, nutrition, from physiotherapy, prophylaxis or ABC. These are the principles of treatment. So we need to give antitoxin, we need to give antibiotics, we need to clean the wound, we need to manage autonomic dysfunction by magnesium sulfate, by barbiturates, anticonvulsants, supportive treatment. Antitoxin is given, immunoglobulin is given. Like rabies, both vaccine and immunoglobulins are given in case of tetanus. Further toxin production should be prevented by immunoglobulins. Antibiotics, they are given. They have a role in controlling tetanus. Penicillin G is drug of choice. And we can also give metronidazole. So you have to remember 2 antibiotics, penicillin G and metronidazole. Skeletal muscle relaxant. They are important because there is rigidity, there is spasm. We need to control the spasm. Tetanus is a preventable disease. Vaccination is given to every child at the age of 6 weeks, 10 weeks, and 14 weeks. It is included in EPH schedule. Thus, booster dose is given at the age of 2 years and at the age of 5 years. All these 5 doses are given to every children under 5 years in Pakistan. We can give this vaccine. Adults can also be vaccinated. What is post-exposure prophylaxis of tetanus? You have to remember A, B, C, D. In A, in wounds, like in clean wounds, we need to give A, we need to vaccinate. We need to vaccinate in B, we need to vaccinate in C. But in D case, we need to give immunoglobulins. In other wounds, in immunity category, those who are immunocompromised, we can give immunoglobulin and vaccine. Remember this, these categories A, B, C, D. In category A, B, C, only vaccine is given to normal wounds. But in category D, vaccine plus immunoglobulins. What is category A? People who have completed their dose with booster dose in the past 5 years, only vaccine is given. What is category B? People who have completed their booster doses less than 10 years ago. They are placed in category B. Category C, more booster dose was given more than 10 years ago. Category D, there is no history. Our immunity status is unknown. So you can categorize. It's a common university question. It is asked in MCQ that a person who was vaccinated previously in the past 5 years with booster dose, only vaccine is given. And a person who was given booster dose 10 years ago, less than 10 years ago, vaccination is given. A person who was vaccinated more than 10 years, vaccine plus immunoglobulin. Or a person, no immunity status is known, he can be given vaccine plus immunoglobulins. There is active and passive immunization. 1500 international units of ATS should be given. 6 weeks later, tetanus toxoid. After 1 year, booster dose is given. There are schedules of tetanus. In adults, we can give vaccine at 0 dose, then after 1 month, then after 6 months, then after 1 year, and after 1 year. These are booster doses. Dose is 0.5 ml. Tetanus toxoid is given. Route of administration is intramuscular. So intramuscular vaccine is given to adults at 0 days. Then after 1 month, 6 months, then 2 booster doses are given. The prevention of neonatal tetanus. It can be prevented. We can prevent mortality of neonates due to tetanus by taking preventive measures. There are 3 C's: clean hands, clean delivery, surface should be cleaned, cold care, hand care, delivery care, and cold care. It is very essential in preventing neonatal tetanus. Mother should be vaccinated, child should be vaccinated immediately as early as possible. Booster dose can be given for newborn. If a newborn is born from unimmunized mother, we should give 500 international units of immunoglobulin within 6 hours of birth. Time is very important. As soon as we manage it, there are lesser chances of death. There are lesser chances of mortality. So we need to manage it in time. Plus, we need clean delivery, clean hands, clean surface, clean cord care. Then tetanus toxoid to mother as early as possible. Booster dose can be given, and neonates who are born from unimmunized mother, 500 international units of immunoglobulin should be given within 6 hours of birth. They are not weeks, they are hours. Minutes are important. We need to save lives. So, we have discussed various zoonotic diseases like rabies, brucellosis, plague, scabies, tetanus. What is rabies? Things to remember. It is common in dog bite, common in rural areas. Dogs transmit through saliva. Rabies virus is transmitted to saliva. And what it causes? Intolerance. Hydrophobia is common. You need to remember, we need to give vaccine plus immunoglobulins. What is vaccination schedule? 0 is 7, 14, 21. Who should be vaccinated? High risk people. After exposure, after dog bite, people should be immediately vaccinated. They should be managed within 6 days. Otherwise, it's a fatal. Case fatality is higher in rabies. It is impossible to save a person after 6 days. So we need to give vaccine. Plus, prophylactic vaccination is also done in people living near jungles, in endemic areas, working in zoos, farmers. They should be vaccinated. Immunoglobulins should be given. There should be wound care. These are points to remember in rabies. These are commonly asked in university. Vaccination schedule, plus immunoglobulins, plus wound care. Then we discuss brucellosis. After ingestion of milk, or eating of meat, it spreads. So we need to properly cook the meat. We need to boil the milk. Animals should be vaccinated. Antibiotics can be used in treatment. Then we discuss plague. It spread from rats. It was highly fatal in previous centuries. It spreads to droplet infection. It spreads to direct contact. You must remember, it can cause swelling of lymph nodes, femoral and inguinal. It can cause disseminated intravascular coagulation, meningitis, plus multi-organ failure. We can treat plague by streptomycin, by erythromycin. Antibiotics have a role in treatment of plague. Before the invention of erythromycin, it was highly fatal. Now it is controlled. We have to control rodents. We have to control rats. Then we discuss scabies. Remember, scabies is a highly contagious disease. It spreads rapidly. It spreads from person to person. It spreads through close contacts. So it is common in school children, common in family members, people who are living in barracks, in overcrowded places. Scabies is common. It can cause severe itching, hands, palms, neck, scalp, there are burrows. We can diagnose it clinically. An ideal way to manage scabies is to treat all the family members. We need to treat all the close contacts. So all family members should be treated. Permethrin can be given. Ivermectin can be given in immunocompromised people. Antihistamine can also be given. Hygiene is very important in control of scabies. Hygiene is essential measures. We need to educate people regarding personal hygiene in order to control scabies. It causes severe itching, especially at night time. We need to improve the hygiene. Clothes should not be shared. Bed sheets should not be shared. Room should not be shared. It spreads. So we need to control the spread. We need to limit the spread of scabies by improving hygiene. After application of this lotion, person should take bath in the morning. He should change the clothes. Then we discuss tetanus, bacterial disease caused by Clostridium tetani, ventable disease, spreads from spores. Clostridium tetani spreads from spores. It causes spasm, it causes lockjaw, muscular spasm, descending paralysis. There is a phystotonus, there is a rhizus sardonicus, there is paralysis of muscles. Person becomes irritable. We need to manage it. How we can control it? We can control it by bed rest. Rest at dark place. Cause personal being become intolerant to noise and light. There is complete bed rest. There should fluid should be given. Nutrition should be improved. Muscle relaxant should be given. Barbiturates magnesium sulfate should be given. Antibiotics can be given. Physiotherapy can be done. Anticonvulsants can be given. We need to nurse the patient of tetanus at a dark place. Then, both vaccines and immunoglobulins should be given to control tetanus. Vaccination plus immunoglobulins. Wound should be cleaned. Plus, remember that tetanus vaccination is included in EPA schedule. It is given at the age of 6 weeks, 10 weeks, 14 weeks. Booster doses are given after at the age of 2 years and 5 years. Plus, a person who becomes injured, plus who has a wound, we need to vaccinate against tetanus. We need to remember A, B, C, D, E. Who falls in A category? who have completed their course after vaccination plus booster dose. B category who have completed their course, booster dose is given before 10 years. C category, those who have completed but booster dose was given before 10 years. So category A and B should be vaccinated, C and D should be given immunoglobulins. Plus, we need to remember that tetanus spreads from mother to child through vertical transmission. It can cause tetanus neonatum. It can cause severe spasms, respiratory paralysis, death in neonates. How to control it? Mother should be vaccinated during pregnancy. Delivery should be clean. Cord care should be done. Surface care should be done. Delivery should be done by trained healthcare workers. Septic measures should be taken. These are essential steps. Mother should be given booster dose. A child who is born to a mother who was unimmunized or whose immunization was not done, what should be done? We need to give tetanus immunoglobulins immediately within 6 hours to reduce the mortality. Otherwise, mortality is greater in neonates. We need to control it. We must remember that we can give antibiotics also. So, tetanus is a preventable disease and treatable disease. After addition of tetanus vaccine in EPI schedule, mortality is reduced, burden is reduced, tetanus neonatum is reduced. But we need to educate our people regarding these zoonotic diseases. They can be highly fatal. They can increase the burden, like rabies is highly fatal. Brucellosis can be fatal. Plague is fatal cause it causes end organ failure. Scabies is highly contagious. We need to minimize the agony. We need to control scabies. We need to improve hygiene. And it can be done through health education. We need to tell our people, we need to guide our people that in order to control brucellosis, they should boil milk, they should properly cook meat, they should identify scabies. Permethrin is given. Personal hygiene is maintained. And tetanus is preventable disease. We need to vaccinate our children. We need to control this infection. We need to limit the burden. Otherwise, there will be spasm, muscular spasm, there is sardonicus, opisthotonus. Person can die due to these complications. Plus, common university question that immunoglobulin and vaccination both are given in rabies and in tetanus. You should remember this. These are we are concerned with prevention, so prevention of plague is important. Prevention and control of rabies is important. Vaccination schedule of rabies is important. Prevention and control of brucellosis is important. Scabies is very important. It is asked frequently in university because it is a common problem in Pakistan. In schools, child sit together, they play together, they share the food, they share the clothes. And tetanus. This is highly fatal disease. This can be controlled. Hygiene, health education, per isolation, notification. These are essential measures. Plus, we need to improve the nutrition. We need to improve the diet. And in dog bite, remember that treatment or management, vaccination and immunoglobulins and management should be done before 6 days of exposure. Otherwise, it is highly fatal. Rabies fatality can be 100%. Lot of people are dying. We are living in developing world. People are residing in rural areas. They have lesser education. So we need to guide them. We need to tell them what measures they can take, what measures are required to control these important zoonotic problems of public health. They are emerging problems. In Pakistan, all these diseases, burden of all these diseases is increasing, especially rabies. So we need to manage this, we need to control this. That's all.